Oh, no. Is that coming through?
That's good.
Okay, perfect. Well, good evening, and thank you to the El Cerrito Community Council for the opportunity to meet with you all today and discuss specifically what we are doing around coordinated street outreach activities. My name is Jonathan Herrera. I'm a special programs manager and senior policy advisor with the San Diego Housing Commission. And in that capacity, I oversee the operations of the city's shelter portfolio, coordinated street outreach, and coordinated intake across the entire city. And with me, I'm joined by Ketra Carter, is our senior outreach coordinator. She's on my team and is responsible for not only administering the contracts associated with the coordinated street outreach program, but also for providing technical assistance, coordinating logistics, and just really overseeing the day-to-day operations of our outreach teams and providing support as necessary. So the coordinated street outreach program is comprised of all of the city's outreach teams, whether they be associated with a shelter program or there be an independent outreach team. And the intent of these outreach teams are not only to engage individuals experiencing unsheltered homelessness, but to really support the goal of reducing unsheltered homelessness as outlined in the community plan, which has a goal over the next 3 years of reducing that count by 50%. The program includes operating agreements with Alpha Project, Downtown San Diego Partnership, Father Joe's Villages, PATH, and the San Diego LGBT Community Center. And with the implementation of this initiative, the City and Housing Commission really took it as an opportunity to implement a strategy that focused on the quality of client engagements versus the quantity. And it also provided an opportunity to strategically coordinate outreach across the entire city, to deploy street-based case management resources, to create neighborhood-based outreach teams, as well as to respond to individual and community requests for service. A few key features of the service model include a focus on consistent, proactive client engagement, maintaining low barrier operations to ensure that resources are accessible as possible, facilitating connections to supportive services, emergency shelters, and the ultimate goal of a permanent housing solution, and assisting clients in meeting their basic needs and improving their sense of safety. So the program utilizes two distinct yet complementary modes of service, two really important functions. The mobile homeless response team, these are the groups of outreach specialists that are assigned to a specific neighborhood. They cover a council district, and within it may be a cluster of communities. These individuals prioritize engaging individuals that are highly vulnerable or are connected to a housing resource. This staff is responsible for providing consistent street-based case management on an ongoing basis with clients that they are connected to. And their responsibilities include crisis intervention, diversion counseling, and system navigation. The rapid response team focuses their activities in areas with known concentrations of individuals experiencing homelessness. And this is across the entire city. These individuals respond to service requests that they receive from the Get It Done app, client referrals from 211 San Diego, and community requests that we receive through the council office. When these folks engage clients, their primary focus for that specific time frame is on rapid resolutions, problem-solving conversations, and when necessary, connecting those individuals with emergency resources. Outreach takes place across the entire city, 7 days a week, including the weekends, and we also have evening outreach teams up until 10 p.m. So as part of the responsibilities of outreach teams across the city is really facilitating ongoing field assessments. They maintain a record of areas with high concentrations of individuals experiencing homelessness. And when we identify instances where there's an active encampment, a large congregation of individuals, the Housing Commission will coordinate a focused outreach event to facilitate a multidisciplinary and cross-jurisdictional approach to engaging these individuals, just to make sure that we are resourced appropriately to meet those individuals' needs and make an impact in the community. These events are coordinated in conjunction with the assigned outreach team, the County of San Diego, and a federally qualified health center, and when appropriate, the San Diego Police Department's homeless outreach team. Between October 19th and October 28th, a focused outreach event was hosted in Council District 9 to engage in encampment along Home Avenue, as well as a few priority areas that were identified in the Hollywood Park neighborhood. The event included 16 staff from 8 partner organizations, including the Regional Task Force on the Homeless, the County of San Diego, they actually had a couple departments there, La Maestra Community Health Centers, and San Diego Police Department's Homeless Outreach Team, as well as the outreach teams that are assigned to service the council district. So with that, I'm going to briefly turn it over to our Senior Outreach Coordinator to provide some details on the event.
Thank you, Jonathan. So as part of these events, we established a base of operations to provide space for client interactions. At this particular event, we established that base of operations at the Arco gas station on Home Avenue with permission from the property owner. We offered an array of resources that were co-located on site. This included county staff, public health nurses, case management services, and La Maestra Community Health Center's mobile medical unit. Clients were also provided hygiene kits, refreshments, sack lunches, and access to basic essentials. Our outreach activities and care coordination was reviewed on a daily basis at the end of each day. This is to identify any necessary changes or improvements in real time. The encampments we identified were comprised of single adults, couples, or households with familial relations, with a majority identifying the surrounding community as their place of residence. Although the event has concluded, we do have an outreach team that will continue to visit the site to monitor activities as well as follow up with clients receiving services. And over the 2-week initiative, our staff documented 118 client interactions and were successfully able to enroll 20 clients into street-based case management. In addition to that, 10 other clients agreed to accept placement into permanent shelter and continue their housing plan from there. Next slide. On-site public health nurses and benefit specialists facilitated access to vaccines and supportive services, where 25 of these clients were connected with public assistance programs that included County General Relief, CalFresh, and Medi-Cal insurance. In addition to that, we also were able to administer 13 individuals with a COVID vaccination or a flu vaccination. Back to you, Jonathan.
Thank you, Ketra. So to date, the following locations are frequented by our outreach teams in Council District 9. The first one we see here is El Cerrito. An area of focus for that outreach team is on El Cajon Boulevard between 54th Street and College Avenue. In Rolando Village, we have El Cajon Boulevard from College Avenue to 70th Street. Definitely Clay Park, the post office, and the old business Instaprint. In City Heights, we have Home Avenue, Hollywood Park, Azalea Park, El Cajon Boulevard from Fairmount Avenue to Menlo. In the corridor community, 35th Street from El Cajon Boulevard to Adams Avenue and the Adams Avenue Community Park. And in the college area, we have El Cajon Boulevard from Montezuma to 70th, as well as the College Rolando Library. And then in Talmadge and Kensington, El Cajon Boulevard from Euclid Avenue to 54th Street, up to Monroe and back down to Euclid Avenue. So when we're talking about the outreach teams assigned to your council district, this is comprised of both a team from PATH and a staff from Alpha Project. It's a total of 1.5 street-based case management personnel, and this is going to be increased here in probably the next month or so as we fill vacancies with the operating agreement with PATH by 1 additional staff. So we'll have about 2.5 street-based case managers assigned to the council district. On the other hand, about 20% of the rapid response team, their time is spent responding to service requests in the council district, which equates to about 2 additional full-time positions. So at any given time, there will be anywhere between 3 and 4 outreach specialists engaging clients in the area. We're continuing to ramp up operations and recognize that there's definitely opportunity to increase outreach presence throughout the city, and we'll maintain that goal of an equitable distribution of resources based on community need. The following slide provides a summary of outcomes since the beginning of the fiscal year through the 15th, a couple days ago. We currently have 84 individuals enrolled with the mobile homeless response team. These are individuals, again, actively receiving services. We have 71 individuals enrolled with our rapid response team. And again, these are clients that are coming to us through the Get It Done app and are subsequently followed up by staff. There might be getting checked in with them on a daily basis, trying to get them to get connected with case management services or trying to facilitate placement into shelter. We've facilitated 22 exits to permanent or longer term housing with another 21 pending. We've placed 11 individuals into shelter. There's been 233 instances of supportive services, including 90 since just the beginning of this month, and 7 instances of supportive service referrals to employment, legal, medical, mental health, or substance abuse services. And these outcomes really require a consistent approach that often extends it really often takes an extended period of time to not only build the rapport necessary to support these individuals, but to assist them with identifying the appropriate housing solution for their circumstance. On average, placements into shelter is taking about 32 days, and placements into permanent housing is taking around 77 days. This speaks not only to the high acuity of clients that our staff are encountering, but the importance of neighborhood-based outreach teams to facilitate these activities on an ongoing and consistent basis. So before we conclude the presentation, wanted to share some information for you for your future reference, and I'm happy to share a copy of this PowerPoint for future reference. But a couple elements on here. 211 San Diego is a mechanism that clients experiencing homelessness can access street-based case management. Once they contact this hotline, they'll be connected with an outreach specialist, most often the outreach team assigned to that specific council district. Residents can submit service requests through Get It Done, which now has the functionality to report active encampments or individuals that may benefit from outreach assistance. These will be assessed by the rapid response team and then referred to the case management team assigned to the council district if that client's interested in ongoing case management services. We also want you to visit the Housing Commission Service Dashboard, the Homeless Services Dashboard, which serves as an interactive tool in presenting aggregate data on all households served by the Housing Commission and City of San Diego homeless service programs, including outreach. In fact, there's a outreach service map that's going to be continually updated, revised, and improved on to provide reflect data on activity around outreach at both the council district and community level. The last thing I wanted to share is the Council District 9 Homeless Forum that took place yesterday. I think a few of you guys might have participated in that forum as well. But if you'd like to view the event, you can use that link there, and the council office has made that available. And with that, I'll turn it back to the chair.